Welcome to today's session. I am JEMISHA, working as Assistant Professor at Emmanuel Arthur College of Pharmacy. In this video, we will learn about disorders of cardiovascular system. A cardiovascular disorder refers to any disease or condition that affects the heart and blood vessels, impairing normal blood circulation. These disorders impact the delivery of oxygen and essential nutrients to the body. Common cardiovascular diseases include coronary artery disease, hypertension, heart failure, arrhythmias, and stroke. They can result from structural, functional, or electrical abnormalities within the cardiovascular system. First, hypertension. Hypertension or high blood pressure is defined as persistently elevated systolic blood pressure of 130 mmHg or diastolic pressure 80 mmHg. Blood pressure reflects the force exerted by blood on the walls of the arteries, influenced by the heart's pumping action and the resistance of blood vessels. Normal blood pressure is considered to be 120 by 80 mmHg. If left uncontrolled, hypertension increases the risk of heart attack, stroke, and other cardiovascular complications. Next, hypotension. Hypotension or low blood pressure occurs when arterial blood pressure drops below the normal range, usually below 90 by 60 mmHg. This condition can lead to insufficient blood flow to vital organs like the brain, heart, and kidneys. Severe or prolonged hypertension may result in tissue hypoxia, organ dysfunction, or even organ failure. Clinically, hypotension is significant when it produces symptoms or impairs the functions of essential organs. Next, arteriosclerosis. Arteriosclerosis is a chronic condition characterized by thickening, hardening, and loss of elasticity in the arterial walls. This results in reduced blood flow to organs and tissues. It increases vascular resistance, contributing to hypertension and other cardiovascular complications. It includes thickening of the arterial layers, loss of elasticity, and narrowing of the arterial lumen, which can impair normal blood supply. Next, atherosclerosis. Atherosclerosis is a progressive disease of the arteries characterized by the formation of fatty plaques, also called atheromas, within the inner layer of the arterial walls. These plaques contain lipids, cholesterol, calcium, and inflammatory cells, leading to thickened and hardened arteries. Narrowed arteries reduce blood flow and may rupture, causing blood clots, heart attacks, or stroke. This condition primarily affects large and medium-sized arteries such as the coronary, carotid, and aortic arteries. It is both an inflammatory and degenerative process. Next, angina. Angina is a clinical syndrome marked by chest discomfort or pain, occurring when the oxygen demand of the heart exceeds its supply. It is often caused by reduced blood flow through the coronary arteries due to atherosclerosis. Patients typically describe it as pressure, heaviness, or tightness in the chest, which may radiate to the left arm, neck, jaw, or back. Angina is often triggered by physical exertion, emotional stress, or heavy meals, and is usually relieved by rest or medication such as nitroglycerin. Next, myocardial infarction. Myocardial infarction, commonly known as heart attack, occurs when a portion of the heart muscle undergoes irreversible death due to prolonged lack of blood supply. This is usually caused by the sudden blockage of the coronary artery, often resulting from a ruptured atherosclerotic plaque followed by clot formation. Myocardial infarction leads to permanent damage if blood flow is not restored promptly. Symptoms include severe and persistent chest pain, sweating, nausea, shortness of breath, and anxiety. Next, congestive heart failure. Congestive heart failure is a clinical syndrome in which the heart cannot pump blood effectively to meet the body's metabolic demands. This can result in congestion in the lungs, or systemic circulation, causing symptoms like fluid overload, impaired organ perfusion, and swelling. Heart dysfunction may be due to impaired contraction, known as systolic dysfunction, or impaired relaxation, called diastolic dysfunction. Over time, heart enlargement, pulmonary edema, and peripheral edema may develop. Next, cardiac arrhythmias. Cardiac arrhythmias are disturbances in the heart rate, rhythm, or electrical sequence leading to irregular, too fast, or too slow heartbeats. These can affect cardiac output and blood flow, sometimes causing palpitations, dizziness, fainting, or even heart failure. Acute arrhythmias can involve the atria, ventricles, or both, and may be transient or persistent depending on severity and underlying causes. Thank you.